We've done a couple of studies that have compared the built and social environment of individuals with psychiatric disabilities and the general population. And we're actually currently working on several more studies that we hope will shed light on this topic. The first study that I'm going to talk about today is actually a study that we did with Stephen Metro. I participated in it, Janet Purview-Bedger, Irene Wong, and Mark Salzer. And this study was published in the journal called Health and Place in 2012. In this study, we compared the geographic access and availability of community resources for individuals with psychiatric disabilities and for the general population. So the community resources that we focused on in this study were actually considered to be important by individuals with psychiatric disabilities. We've conducted a survey with them and we asked which community resources they found to be more important, and we focused on those in the study. So what we found is that individuals with psychiatric disabilities actually lived in neighborhoods that gave them greater geographic access to and availability of most types of commercial community resources. And those resources included restaurants, supermarkets, banks, barbershops, cleaners, and also individuals with psychiatric disabilities had greater access to and availability of most types of healthcare facilities, which included hospitals, pharmacies, and community mental health services. So in addition to that, individuals with psychiatric disabilities lived closer to libraries and post offices than the general population, and they had more places of worship within a half-mile radius of their houses than the general population. When it came to public transportation, the findings were actually mixed because individuals with psychiatric disabilities lived closer to subway and regional rail stops, but they lived a little farther away than the general population from bus stops that served 4 or more routes. So these are bus stops that a lot of people take. And finally, we found that individuals with psychiatric disabilities lived farther away from shopping centers and department stores than the general population. So that's the first study. The second study was by Thomas Byrne, Janet Purview-Bedger, myself, Irene Wong, Stephen Metro, and Mark Salzer. And this study was published in Psychiatric Services in 2013. So in this study, we compared various aspects of the built and social environment for individuals with psychiatric disabilities and the general population. And we found that actually neighborhoods where individuals with psychiatric disabilities lived had higher levels of physical and structural inadequacy, which we defined as more vacancy, more gas shutoffs, lower house price, lower rents, and lower household incomes. Individuals with psychiatric disabilities lived in neighborhoods that had more drug-related activity, higher crime levels, which we defined as robberies, burglaries, thefts, car thefts, graffiti, and vandalism. So in addition to that, we found that higher concentrations of individuals with psychiatric disabilities in a neighborhood were associated with higher levels of physical and structural inadequacy, crime, drug-related activity, social instability, which we define as high levels of renter-occupied households, high levels of one-person households, and high levels of recently moved households, and also high levels of social isolation, which we define as greater numbers of commercial and industrial properties. So that's the second study that we did. And currently, we're in the process of using innovative technologies such as geographic information systems, global positioning systems, and accelerometry to examine how various aspects of the environment are related to individuals' community participation and other psychosocial outcomes. So stay tuned for more updates from us. Thank you for listening.